Question 1. Quality control measures reveal that the Certified Veterinary Pain Practitioner (CVPP) certification body is reviewing potential future directions for pain management research that will influence curriculum development and continuing education requirements. Which of the following research focuses, if prioritized, would most effectively advance the field of veterinary pain management in the coming decade, considering both scientific innovation and clinical applicability? Option A. The development and refinement of advanced regenerative medicine techniques and targeted neuromodulation therapies, coupled with a deeper understanding of the neurobiological mechanisms of chronic pain. Option B. The optimization of existing analgesic drug classes through improved delivery systems and combination therapies. Option C. The investigation of highly theoretical pain pathways with limited immediate clinical application, but significant potential for future paradigm shifts. Option D. The exploration of novel, non-pharmacological comfort measures and environmental enrichment strategies for chronic pain patients. Correct answer is A. The development and refinement of advanced regenerative medicine techniques and targeted neuromodulation therapies, coupled with a deeper understanding of the neurobiological mechanisms of chronic pain. Explanation. Scenario analysis. This scenario presents a professional challenge as it requires a certified veterinary pain practitioner, CVPP, to evaluate the potential impact of emerging research on future pain management strategies. The challenge lies in discerning which research avenues are most likely to yield clinically relevant and ethically sound advancements, while also considering the practicalities of implementation and regulatory acceptance within the veterinary field. Careful judgment is required to prioritize research directions that align with the core principles of animal welfare and evidence-based practice. Correct approach analysis. The correct approach emphasizes the integration of novel therapeutic modalities, such as advanced regenerative medicine and targeted neuromodulation, with a deeper understanding of the neurobiological underpinnings of chronic pain. This represents best professional practice because it is forward-looking, grounded in scientific inquiry, and directly addresses the limitations of current pain management. It aligns with the CVPP ethical obligation to provide the highest standard of care by actively seeking and evaluating innovative solutions that can improve patient outcomes. Furthermore, this approach anticipates the need for future regulatory frameworks to adapt to these advancements, ensuring that new therapies are both safe and effective. Incorrect approaches analysis, focusing solely on refining existing pharmacological interventions, while important, represents a failure to embrace the potential of future research. This approach risks stagnation and overlooks opportunities for more transformative improvements in pain management. Ethically, it could be seen as a missed opportunity to advance animal welfare beyond current capabilities. Prioritizing research into purely palliative care without exploring disease-modifying or restorative approaches neglects the potential for long-term pain resolution or significant reduction. This approach may fall short of the CVPP duty to explore all avenues for improving a patient's quality of life, and could be considered ethically insufficient if more effective, albeit novel, treatments become available. Investing heavily in research that lacks a clear pathway for clinical translation or regulatory approval, such as highly theoretical concepts with no immediate practical application, is an inefficient use of resources and may not directly benefit animal patients in the foreseeable future. This could be viewed as a deviation from professional responsibility to focus on actionable advancements. Professional reasoning. Professionals should approach future directions in pain management research by first assessing the potential for significant clinical impact and alignment with ethical principles of animal welfare. This involves critically evaluating the scientific rigor of emerging research, considering the feasibility of translation into veterinary practice, and anticipating the need for robust evidence to support new therapies. A balanced approach that integrates novel modalities with a deeper understanding of pain mechanisms, while remaining mindful of practical implementation and regulatory considerations, is crucial for advancing the field and ensuring the best possible outcomes for animal patients. Question 2. Governance review demonstrates that effective veterinary pain management hinges on accurate and objective assessment of animal behavior. When evaluating a canine patient for potential chronic pain, which approach to behavioral assessment is most aligned with the principles of evidence-based practice and the standards expected of a certified veterinary pain practitioner. Option A. Employing a validated, species-specific observational pain scale that quantifies specific pain-related behaviors. Option B. Utilizing a generic checklist of common animal behaviors without regard for species-specific pain indicators. Option C. Relying exclusively on the owner's subjective description of the dog's general demeanor and activity level. Option D. Considering only the absence of obvious lameness or vocalization as indicators that pain is not present. The correct answer is A. Employing a validated species-specific observational pain scale that quantifies specific pain-related behaviors. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent subjectivity in behavioral assessment and the critical need for objective, reproducible data in veterinary pain management. The CVPP designation implies a commitment to evidence-based practice, requiring practitioners to move beyond anecdotal observations to validated assessment tools. The challenge lies in selecting and applying these tools appropriately within the context of individual patient variability and the specific pain condition being managed. Correct approach analysis. The correct approach emphasizes the use of validated, species-specific behavioral scales that have demonstrated reliability and sensitivity in detecting pain-related behaviors. This aligns with the principles of evidence-based veterinary medicine and the ethical imperative to provide the highest standard of care. Utilizing such scales allows for objective quantification of behavioral changes, facilitating more accurate diagnosis, effective treatment monitoring, and informed adjustments to pain management protocols. This systematic approach minimizes bias and enhances the reproducibility of assessments, which is crucial for demonstrating treatment efficacy and patient welfare, aligning with the professional standards expected of a CVPP. Incorrect approach is analysis. An approach relying solely on the owner's subjective report without corroboration from objective behavioral assessment tools is ethically problematic. While owner input is valuable, it can be influenced by emotional factors or a lack of objective reference points, potentially leading to misinterpretation of the animal's pain status. This failure to employ objective measures can result in under- or overtreatment, impacting patient welfare and potentially violating the duty of care. Another incorrect approach involves using generalized, non-species-specific behavioral checklists. These tools may not capture the nuanced pain-related behaviors specific to a particular species or breed, leading to inaccurate assessments. The lack of validation for the target species means the observed behaviors may not reliably indicate pain, thus compromising the diagnostic and therapeutic process and falling short of professional standards. Finally, an approach that prioritizes the absence of overt vocalization or lameness as indicators of pain is insufficient. Many animals, particularly those with chronic pain, may exhibit subtle behavioral changes that are not readily apparent as dramatic signs. Relying on such limited indicators risks overlooking significant pain, leading to inadequate pain management and a failure to meet the ethical obligation to alleviate suffering. Professional reasoning. Professionals should adopt a systematic approach to behavioral assessment in pain management. This involves first identifying the most appropriate, validated, species-specific behavioral assessment tools for the patient's condition. Second, they must be proficient in administering these tools consistently and objectively. Third, they should integrate the data from these tools with other clinical findings, including owner observations and physical examination, to form a comprehensive picture of the patient's pain. Regular reassessment using the same validated tools is critical for monitoring treatment effectiveness and making informed therapeutic decisions, ensuring the highest standard of care and adherence to professional and ethical guidelines. Question 3. Risk assessment procedures indicate that a canine patient presents with signs suggestive of abdominal discomfort. Considering the differential distribution of pain receptors throughout the body, which of the following statements most accurately reflects the typical neurophysiological basis for visceral pain perception compared to somatic pain? Option A. Visceral pain is typically characterized by a higher density of highly specific nociceptors, leading to sharp, well-localized sensations similar to cutaneous pain. Option B. Somatic pain is primarily mediated by C fibers, resulting in a slow, burning sensation, while visceral pain is transmitted by A delta fibers, producing sharp, immediate pain. Option C. Both visceral and somatic pain receptors are uniformly distributed throughout all tissues, meaning the location and intensity of pain are perceived identically regardless of the affected organ system. Option D. Visceral pain is often poorly localized and described as dull, aching, or cramping due to the lower density and more diffuse distribution of nociceptors within visceral organs, often involving different receptor types and afferent pathways than somatic pain. The correct answer is A. Visceral pain is typically characterized by a higher density of highly specific nociceptors, leading to sharp, well-localized sensations similar to cutaneous pain. Explanation: scenario analysis. This scenario is professionally challenging because it requires the Certified Veterinary Pain Practitioner, CVPP, to integrate knowledge of neuroanatomy and physiology with practical clinical application, specifically concerning the distribution of pain receptors. Misinterpreting or oversimplifying the distribution of nociceptors can lead to inadequate pain assessment, inappropriate treatment selection, and ultimately, compromise patient welfare. The challenge lies in recognizing that pain perception is not uniform across all tissues and that different receptor types, nociceptors, have specific locations and sensitivities, influencing how pain is experienced and managed. Correct approach analysis. The correct approach emphasizes a nuanced understanding of nociceptor distribution, recognizing that different tissues possess varying densities and types of pain receptors. For instance, visceral pain pathways differ significantly from somatic pain pathways due to the unique innervation of internal organs and the presence of different receptor subtypes, e.g., mechanoreceptors, chemoreceptors, thermoreceptors, and polymodal nociceptors. A CVPP must understand that while skin is densely populated with nociceptors, leading to sharp, localized pain, visceral organs may have fewer, more diffuse nociceptors, often resulting in poorly localized, cramping, or burning pain. This detailed understanding is crucial for accurate diagnosis and effective multimodal pain management strategies tailored to the specific anatomical source of pain. This aligns with the CVPP ethical obligation to provide competent care and the regulatory expectation to base treatment on sound scientific principles. Incorrect approaches analysis. An approach that assumes uniform pain receptor distribution across all tissues is a significant regulatory and ethical failure. It implies a lack of specialized knowledge expected of a CVPP, potentially leading to underestimation or misinterpretation of pain signals. For example, assuming visceral pain is perceived identically to cutaneous pain would lead to ineffective analgesic choices and diagnostic errors. Another incorrect approach would be to focus solely on superficial pain receptors, neglecting the deeper somatic and visceral pain pathways. This oversight would result in inadequate pain management for conditions affecting internal organs or musculoskeletal structures, violating the principle of providing comprehensive pain relief. Furthermore, an approach that generalizes pain receptor function without considering the specific types of nociceptors, e.g., A-delta fibers for sharp, localized pain vs. C fibers for dull, aching pain, and their respective distributions would also be a failure, as it limits the ability to predict pain quality and intensity. Professional reasoning. When faced with a patient presenting with pain, a CVPP should employ a systematic approach. This begins with a thorough history and physical examination, paying close attention to the location, quality, and intensity of the pain. The CVPP must then correlate these findings with their understanding of the underlying anatomy and the expected distribution and function of pain receptors in the affected tissues. This comparative analysis allows for the formulation of a differential diagnosis and the selection of appropriate diagnostic tests and therapeutic interventions. The decision-making process should always prioritize patient welfare, evidence-based practice, and adherence to the highest ethical and professional standards, ensuring that pain management is precise and effective. Question 4. The assessment process reveals a canine patient with chronic osteoarthritis experiencing moderate pain. The veterinarian is considering initiating a non-steroidal anti-inflammatory drug, NSAID, for pain management. However, recent blood work indicates mild renal insufficiency in this patient. Given this information, what is the most appropriate course of action regarding NSAID selection and dosing? Option A. Administer the standard recommended dose of a commonly used NSAID, as mild renal insufficiency is unlikely to significantly impact its pharmacokinetics or pharmacodynamics in this context. Option B. Select an NSAID with a known longer half-life and a wider therapeutic index, and initiate therapy at a reduced dose with increased monitoring for efficacy and adverse effects, particularly focusing on renal parameters. Option C. Immediately switch to a different class of analgesic, such as an opioid, without further pharmacokinetic consideration, to avoid any potential renal impact from NSAID. Option D. Proceed with the standard dose of a short-acting NSAID, assuming that the mild renal insufficiency will not significantly affect drug accumulation or efficacy. The correct answer is B. Select an NSAID with a known longer half-life and a wider therapeutic index, and initiate therapy at a reduced dose with increased monitoring for efficacy and adverse effects, particularly focusing on renal parameters. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practitioner to move beyond a standard dosing regimen and consider individual patient factors that significantly influence drug response. The complexity arises from the interplay of pharmacokinetics, absorption, distribution, metabolism, excretion, and pharmacodynamics, drug effect at the target site, in a specific patient with compromised organ function. Failure to account for these variables can lead to subtherapeutic effects, adverse drug reactions, or even toxicity, directly impacting patient welfare and potentially violating standards of care. Correct approach analysis. The correct approach involves a thorough assessment of the patient's specific physiological status, particularly focusing on organ function that impacts drug metabolism and excretion. This includes evaluating liver and kidney function, as these are primary sites for drug biotransformation and elimination. Understanding the drug's known pharmacokinetic profile and its potential for accumulation or reduced efficacy in the presence of organ dysfunction is crucial. This leads to a reasoned adjustment of the dosage regimen, e.g., dose reduction, increased dosing interval, based on established principles of veterinary pharmacology and the specific drug's properties, aiming to achieve therapeutic efficacy while minimizing risk. This aligns with the ethical imperative to provide individualized patient care and adhere to best practices in veterinary pain management, which are implicitly guided by professional standards and the expectation of competent application of pharmacological knowledge. Incorrect approaches analysis. One incorrect approach involves continuing with the standard published dosage without considering the patient's specific condition. This fails to acknowledge the fundamental principles of pharmacokinetics and pharmacodynamics, which dictate that drug behavior and effect are not uniform across all individuals, especially those with compromised organ systems. This approach risks therapeutic failure or adverse events, potentially violating the duty of care owed to the patient. Another incorrect approach is to arbitrarily reduce the dose without a clear rationale tied to the patient's physiology or the drug's properties. While well-intentioned, this lacks the scientific basis required for effective pain management and could lead to undertreatment of pain, which is a failure to meet the patient's needs. It also bypasses the systematic evaluation of pharmacokinetic and pharmacodynamic principles. A third incorrect approach is to switch to a different analgesic class without a clear understanding of how the new drug's pharmacokinetics and pharmacodynamics will be affected by the patient's organ dysfunction. This can introduce new risks and uncertainties, potentially leading to unforeseen adverse effects or inadequate pain control, and demonstrates a lack of thorough, evidence-based decision-making. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive patient assessment, focusing on factors that influence drug disposition and effect. This includes reviewing the patient's history, performing a physical examination, and utilizing diagnostic tests to evaluate organ function. Next, they should consult reliable veterinary pharmacology resources to understand the pharmacokinetic and pharmacodynamic properties of the chosen analgesic, paying close attention to how organ dysfunction might alter these parameters. Based on this information, a reasoned, individualized dosage adjustment should be formulated, with a plan for close patient monitoring to assess efficacy and detect adverse effects. This systematic, evidence-based approach ensures patient safety and optimizes therapeutic outcomes. Question 5. Quality control measures reveal a discrepancy in how two veterinary practitioners are documenting and managing pain in a feline patient presenting with a persistent limp following a minor fall. Practitioner A focuses on immediate analgesia and observation for resolution within 72 hours, while Practitioner B initiates a multimodal pain management plan that includes long-term anti-inflammatory medication and physical therapy, anticipating a prolonged recovery or adaptation period. Considering the principles of veterinary pain management as defined by the Certified Veterinary Pain Practitioner (CVPP) framework, which Practitioner's approach is more aligned with accurately differentiating and addressing acute versus chronic pain. Option A. Practitioner B's approach, as the inclusion of physical therapy directly addresses the underlying musculoskeletal issue, which is the primary indicator of pain chronicity. Option B. Practitioner A's approach, as the initial focus should always be on resolving acute pain within a defined short-term window before considering more complex pain states. Option C. Practitioner B's approach, as it acknowledges the potential for pain to transition from acute to chronic and implements a proactive long-term management strategy. Option D. Practitioner A's approach, as the absence of severe initial trauma suggests the pain is likely acute and should resolve with immediate intervention. The correct answer is C. Practitioner B's approach, as it acknowledges the potential for pain to transition from acute to chronic and implements a proactive long-term management strategy. Explanation: this scenario is professionally challenging because differentiating between acute and chronic pain in veterinary patients requires a nuanced understanding of pain physiology, patient history, and behavioral observation, all within the context of the Certified Veterinary Pain Practitioner (CVPP) regulatory framework. The CVPP designation implies a commitment to evidence-based pain management and adherence to ethical guidelines that prioritize animal welfare. Misclassifying pain can lead to inappropriate treatment strategies, potentially causing patient suffering and failing to meet professional standards. The correct approach represents best professional practice because it involves a comprehensive assessment that considers the duration, intensity, and impact of pain on the patient's quality of life, aligning with the CVPP mandate to provide optimal pain relief. This approach emphasizes a systematic evaluation of the patient's history, physical examination findings, and response to interventions, all of which are crucial for accurate diagnosis and effective treatment planning under the CVPP guidelines. Incorrect approaches fail to meet professional standards by oversimplifying the diagnostic process or relying on incomplete information. Focusing solely on the presence of a recent injury without considering the chronicity of the pain response neglects the potential for maladaptive pain pathways to develop. Similarly, assuming pain is chronic based solely on the absence of an obvious acute cause overlooks the possibility of subtle or undiagnosed acute conditions. These approaches risk inadequate pain management, potentially violating ethical obligations to alleviate suffering and the professional responsibilities inherent in the CVPP certification. The professional decision-making process for similar situations should involve a structured approach. First, gather a thorough patient history, including the onset, duration, and nature of the pain. Second, conduct a complete physical and neurological examination, looking for objective signs of pain or underlying pathology. Third, consider diagnostic imaging or other tests if indicated to identify the cause of pain. Fourth, evaluate the patient's response to any previous or current treatments. Finally, integrate all findings to differentiate between acute and chronic pain, thereby guiding the selection of appropriate, evidence-based therapeutic interventions that align with the CVPP commitment to animal welfare and professional excellence. Question 6. The audit findings indicate a recurring pattern of suboptimal pain management in cases involving chronic neuropathic pain. Which of the following approaches best addresses this finding by focusing on the neuroanatomy of pain processing? Option A. Relying on client testimonials and anecdotal reports of pain relief from various modalities to guide treatment decisions for neuropathic pain cases. Option B. A comprehensive review of the ascending and descending pain pathways, including the role of the dorsal horn in signal transduction, the thalamus in relaying nociceptive information, and the somatosensory cortex in pain perception, to inform diagnostic and therapeutic strategies. Option C. Implementing a standardized protocol for administering broad-spectrum analgesics based on presenting clinical signs, without specific consideration for the underlying neuroanatomical mechanisms of neuropathic pain. Option D. Prioritizing the use of the least expensive pain management options available, regardless of their specific efficacy, in addressing the neuroanatomical basis of neuropathic pain. The correct answer is B. A comprehensive review of the ascending and descending pain pathways, including the role of the dorsal horn in signal transduction, the thalamus in relaying nociceptive information, and the somatosensory cortex in pain perception, to inform diagnostic and therapeutic strategies. Explanation: this scenario is professionally challenging because it requires the practitioner to integrate complex neuroanatomical knowledge with risk assessment principles in a clinical context, directly impacting patient care and potentially leading to adverse outcomes if misapplied. The audit findings highlight a potential systemic issue in how pain processing is understood and managed, necessitating a proactive and evidence-based approach. The correct approach represents best professional practice because it directly addresses the identified audit finding by focusing on the fundamental neuroanatomical pathways involved in pain. Understanding the specific roles of the dorsal horn, thalamus, and somatosensory cortex in nociception, modulation, and perception is crucial for accurate diagnosis and effective treatment planning. This approach aligns with the core competencies expected of a certified veterinary pain practitioner, emphasizing a deep understanding of the biological underpinnings of pain. It allows for targeted interventions based on the specific neurobiological mechanisms at play, thereby minimizing risks associated with generalized or ineffective pain management strategies. This aligns with the ethical imperative to provide competent and evidence-based care. An incorrect approach that focuses solely on superficial clinical signs without considering the underlying neuroanatomy fails to address the root cause of the pain processing issue identified in the audit. This could lead to misdiagnosis, inappropriate treatment selection, and ultimately, suboptimal pain relief, potentially violating the standard of care and the practitioner's duty to provide effective treatment. Another incorrect approach that relies on anecdotal evidence or unvalidated techniques, bypassing a thorough neuroanatomical understanding, poses significant risks. This deviates from evidence-based practice, which is a cornerstone of professional veterinary medicine. Such an approach could lead to the use of ineffective or even harmful interventions, exposing the animal to unnecessary suffering and the practitioner to professional liability. It also fails to address the specific neuroanatomical deficit highlighted by the audit, a further incorrect approach that prioritizes cost-effectiveness over a comprehensive neuroanatomical assessment would be ethically and professionally unsound. While financial considerations are important, they should never compromise the quality of care or the accurate diagnosis of pain processing abnormalities. This approach risks overlooking critical neuroanatomical details that are essential for effective pain management, potentially leading to prolonged suffering and increased long-term costs due to chronic pain. The professional decision-making process for similar situations should involve a systematic review of audit findings, a critical evaluation of existing knowledge regarding the neuroanatomy of pain, and the application of this knowledge to develop targeted diagnostic and therapeutic strategies. This involves consulting relevant literature, engaging in continuing education, and collaborating with peers when necessary. The focus should always be on understanding the underlying biological mechanisms of pain to ensure the most effective and ethical patient care. Question 7. Operational review demonstrates that a veterinary practice is utilizing a variety of methods to assess pain in postoperative canine patients, including owner questionnaires, visual analog scales, VAS, developed internally, and occasional observation of behavioral changes by veterinary technicians. The practice is seeking to standardize its approach to pain management and ensure compliance with best practices for veterinary pain management. Which of the following approaches best aligns with the principles of objective and effective pain assessment for these patients? Option A. Utilize a combination of the existing internal VAS and occasional technician observations, with the understanding that pain assessment is inherently subjective. Option B. Continue to rely primarily on owner questionnaires, as they provide the most direct insight into the patient's subjective experience of pain. Option C. Implement a validated species-specific pain scale, such as the Colorado State University Pain Scale, CSUPS, or the Glasgow Composite Measure Pain Scale, CMPSSF, and train all staff on its consistent application and interpretation for postoperative canines. Option D. Develop a new, simplified pain scoring system based on the collective experience of the veterinary team, focusing on easily observable signs. Correct answer is C. Implement a validated species-specific pain scale, such as the Colorado State University Pain Scale, CSUPS, or the Glasgow Composite Measure Pain Scale, CMPSSF, and train all staff on its consistent application and interpretation for post-operative canines. Explanation: scenario analysis. This scenario presents a common challenge in veterinary practice where multiple pain assessment tools are available, each with its own strengths and limitations. The professional challenge lies in selecting the most appropriate and validated pain scale for a specific patient and clinical situation, ensuring consistent and objective pain scoring, and integrating this information effectively into the treatment plan. The need for objective, reproducible pain assessment is paramount for ethical and effective patient care, and failure to do so can lead to undertreatment or overtreatment of pain. Correct approach analysis. The correct approach involves selecting a validated pain scale that is appropriate for the species, age, and condition of the patient, and then consistently applying it throughout the patient's care. This ensures that pain assessment is objective, reproducible, and allows for accurate monitoring of treatment efficacy. Using a validated scale aligns with best professional practice by promoting evidence-based medicine and ensuring that clinical decisions are informed by reliable data. This approach directly supports the CVPP commitment to providing optimal pain management, which is a core tenet of the certification. Incorrect approaches analysis. One incorrect approach involves relying solely on subjective owner reports without incorporating objective clinical signs or a validated scoring system. This is ethically problematic as it can lead to misinterpretation of pain levels, potentially resulting in inadequate pain relief. While owner input is valuable, it should be integrated with objective assessment tools. Another incorrect approach is to use a non-validated or ad hoc scoring system that has not been scientifically tested for reliability and validity. This introduces significant subjectivity and reduces the ability to compare pain scores over time or between patients, undermining the goal of objective pain assessment. This failure to adhere to evidence-based practices is a deviation from professional standards. A third incorrect approach is to use a validated scale but apply it inconsistently, or to switch between different scales without clear justification. This compromises the integrity of the pain assessment data, making it difficult to track treatment effectiveness and potentially leading to suboptimal patient outcomes. This inconsistency can be seen as a failure to maintain professional diligence in patient monitoring. Professional reasoning. Professionals should approach pain assessment by first identifying the species and the specific clinical context. They should then research and select a validated pain scale that has demonstrated reliability and sensitivity for that particular patient population and condition. Consistent application of the chosen scale, along with thorough documentation, is crucial. Regular review of pain scores in conjunction with the patient's response to analgesia should guide treatment adjustments. This systematic, evidence-based approach ensures that pain management is both effective and ethically sound. Question 8. The audit findings indicate a need to review the assessment of a patient presenting with hind limb lameness and apparent hypersensitivity to palpation of the lumbar epiaxial muscles. Which of the following approaches best reflects a comprehensive understanding of the anatomy and physiology of pain in diagnosing the primary source and predicting the impact of potential interventions? Option A. Focusing on the superficial musculature of the hind limbs and initiating treatment based on common orthopedic conditions affecting this area. Option B. Administering a broad-spectrum analgesic and observing for improvement, assuming the pain is generalized and will respond to systemic treatment. Option C. Prioritizing the palpation findings of the lumbar epiaxial muscles and recommending immediate surgical intervention without further investigation into the underlying pain pathways. Option D. Evaluating the patient's gait and range of motion in the hind limbs, then correlating findings with the known innervation of the lumbar spine and pelvic girdle to identify potential sources of nociception and referred pain. The correct answer is A. Focusing on the superficial musculature of the hind limbs and initiating treatment based on common orthopedic conditions affecting this area. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the Certified Veterinary Pain Practitioner, CVPP, to interpret complex anatomical and physiological information in the context of a specific clinical presentation, and then to assess the impact of potential interventions. The challenge lies in accurately identifying the primary pain pathway involved and predicting the likely consequences of targeting it, considering the interconnectedness of the nervous system and the potential for referred pain or compensatory mechanisms. This demands a deep understanding beyond simple memorization, requiring critical thinking and application of knowledge to a novel situation. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's presenting signs, correlating them with known neuroanatomical pathways and physiological responses associated with pain. It requires identifying the most likely origin of the pain based on the distribution of signs and the known innervation of the affected tissues. Understanding the specific roles of different neurotransmitters and receptor types in nociception, as well as the potential for central sensitization, is crucial for predicting how a targeted intervention might affect the overall pain experience. This approach represents best professional practice because it is evidence-based, patient-centered, and aligns with the CVPP ethical obligation to provide competent and effective pain management. It prioritizes a thorough understanding of the underlying pathophysiology to guide therapeutic decisions, minimizing the risk of ineffective or harmful treatments. Incorrect approaches analysis. An approach that focuses solely on superficial signs without considering the underlying neuroanatomy and physiology is professionally unacceptable. This would be akin to treating a symptom without understanding its cause, potentially leading to misdiagnosis and inappropriate treatment. Such an approach fails to meet the standard of care expected of a CVPP, as it neglects the fundamental principles of pain management. Another incorrect approach would be to rely on anecdotal evidence or generalized treatment protocols without specific consideration for the individual patient's anatomy and the precise physiological mechanisms at play. This can lead to treatments that are ineffective or even exacerbate the pain by interfering with compensatory mechanisms or triggering adverse physiological responses. This approach demonstrates a lack of critical evaluation and adherence to evidence-based practice. A third incorrect approach might involve oversimplifying the pain pathways, assuming a linear and direct relationship between stimulus and response. This ignores the complex and often non-linear nature of pain processing, including the role of descending modulatory pathways and the potential for plasticity in the nervous system. Such an oversimplified view can lead to therapeutic decisions that are not only ineffective but also potentially detrimental. Professional reasoning. Professionals should approach such situations by first gathering comprehensive clinical data, including a detailed history, physical examination, and any relevant diagnostic imaging or tests. This data should then be systematically analyzed through the lens of veterinary neuroanatomy and physiology of pain. The practitioner should formulate differential diagnoses for the pain's origin and mechanism, prioritizing those that best explain the observed signs. Next, potential interventions should be evaluated based on their known mechanisms of action and their predicted impact on the identified pain pathways, considering both intended effects and potential side effects or unintended consequences. This iterative process of assessment, hypothesis generation, and intervention planning, grounded in scientific understanding, forms the basis of sound professional decision-making in pain management. Question 9. Market research demonstrates a growing demand for advanced pain management in companion animals. A veterinarian presents a case of a 10-year-old Labrador retriever with chronic hind limb lameness and intermittent vocalization, unresponsive to initial non-steroidal anti-inflammatory drug, NSAID, therapy. The veterinarian suspects a neuropathic component due to the intermittent nature of the pain and the lack of significant radiographic joint changes. As a CVPP, what is the most appropriate initial diagnostic and therapeutic approach to investigate and manage this patient's pain, considering the underlying nociceptive pathways? Option A. Recommend euthanasia due to the chronic nature of the lameness and the failure of initial treatment, without exploring alternative diagnostic or therapeutic avenues. Option B. Prescribe a broad-spectrum antibiotic and a corticosteroid, hypothesizing an underlying inflammatory or infectious process affecting the nerves, without specific diagnostic testing to confirm the etiology. Option C. Increase the dosage of the current NSAID and add a short-acting opioid analgesic for breakthrough pain, without further diagnostic investigation, assuming the pain is solely inflammatory in origin. Option D. Conduct a thorough neurological examination to assess for signs of nerve dysfunction. Consider diagnostic imaging, e.g., MRI, to evaluate for nerve impingement or spinal cord lesions, and initiate a multimodal pain management plan that may include gabapentin or pregabalin to target potential neuropathic pain mechanisms, alongside continued NSAID use if appropriate and safe. The correct answer is D. Conduct a thorough neurological examination to assess for signs of nerve dysfunction. Consider diagnostic imaging, e.g., MRI, to evaluate for nerve impingement or spinal cord lesions, and initiate a multimodal pain management plan that may include gabapentin or pregabalin to target potential neuropathic pain mechanisms, alongside continued NSAID use if appropriate and safe. Explanation: this scenario is professionally challenging because it requires the Certified Veterinary Pain Practitioner, CVPP, to integrate complex neurobiological knowledge of nociceptive pathways with practical clinical application, while adhering to the specific regulatory framework governing veterinary practice in the United States. The CVPP must not only understand the theoretical underpinnings of pain transmission, but also translate this understanding into a diagnostic and therapeutic plan that is both effective for the patient and compliant with Veterinary Practice Acts and professional ethical guidelines. The challenge lies in differentiating between various types of pain and their underlying mechanisms, ensuring that diagnostic and treatment strategies are evidence-based and tailored to the individual animal's condition, and communicating these complex concepts clearly to the client. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the patient's pain. This involves a thorough history, physical examination, and neurological assessment to identify potential sources of nociception. It then moves to a differential diagnosis that considers the specific characteristics of the pain, e.g., somatic, visceral, neuropathic, and the likely involvement of different nociceptive pathways, e.g., A delta and C fibers, dorsal horn processing, descending modulation. This methodical approach ensures that interventions are targeted and appropriate, minimizing the risk of ineffective or harmful treatments. Adherence to established veterinary diagnostic protocols and ethical standards, as mandated by state veterinary practice acts and professional organizations, is paramount. This includes obtaining informed consent from the owner for diagnostic procedures and treatments, and maintaining accurate medical records. An incorrect approach that focuses solely on empirical treatment without a thorough diagnostic workup represents a regulatory and ethical failure. Veterinary practice acts typically require practitioners to diagnose and treat animal patients based on sound medical judgment and established veterinary principles. Prescribing pain management without a clear understanding of the underlying nociceptive pathways and the specific type of pain involved can lead to misdiagnosis, delayed appropriate treatment, and potentially adverse drug reactions. This violates the duty of care owed to the patient and the client. Another incorrect approach might involve extrapolating human pain management protocols without considering species-specific differences in nociception and drug metabolism, or without consulting relevant veterinary literature and guidelines. This can lead to inappropriate dosing, ineffective treatment, or toxicity, and fails to meet the standard of care expected of a CVPP. It also potentially violates regulations that require veterinary practitioners to act within their scope of knowledge and practice, and to utilize treatments proven safe and effective for the species being treated. A third incorrect approach could be to rely on anecdotal evidence or unverified claims about novel pain management techniques without critically evaluating their scientific basis or regulatory approval. This bypasses the rigorous scientific and regulatory scrutiny required for veterinary medical interventions, potentially exposing the animal to unproven or unsafe therapies. This is a failure to uphold the professional responsibility to provide evidence-based care and to protect animal welfare. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive patient information, history, signalment, physical and neurological examination findings. 2. Formulate a differential diagnosis. Consider all plausible causes of pain, categorizing them by likely nociceptive pathway involvement, e.g., peripheral nociception, central sensitization, neuropathic pain. 3. Select appropriate diagnostic tests. Based on the differential diagnosis, choose tests that will help confirm or rule out specific etiologies and elucidate the pain mechanisms. 4. Develop a targeted treatment plan. Interventions should be chosen based on the identified pain mechanisms and supported by veterinary evidence. This includes pharmacologic, non-pharmacologic, and multimodal approaches. 5. Monitor and reevaluate. Continuously assess the patient's response to treatment and adjust the plan as needed. 6. Communicate effectively. Clearly explain the diagnosis, treatment options, prognosis, and associated risks and benefits to the client, ensuring informed consent. 7. Adhere to regulatory and ethical standards. Ensure all actions comply with state veterinary practice acts, professional guidelines, and ethical principles. Question 10. Stakeholder feedback indicates a growing interest among veterinary clients in exploring non-pharmacological interventions for chronic pain management in their pets. As a certified veterinary pain practitioner, you are presented with a case of a canine patient with osteoarthritis experiencing moderate discomfort. The owner is keen to explore acupuncture and therapeutic laser therapy, having heard positive anecdotal reports. Considering the principles of evidence-based veterinary medicine and client-centered care, which of the following approaches best reflects your professional responsibility in this situation? Option A. Inform the owner that while acupuncture and therapeutic laser therapy are options, they are often less effective than pharmacologic interventions and should only be considered as a last resort after all other medical treatments have been exhausted. Option B. Recommend acupuncture and therapeutic laser therapy immediately, as these are popular modalities that clients often request, and focus on the positive anecdotal evidence to reassure the owner of their efficacy. Option C. Proceed with acupuncture and therapeutic laser therapy without extensive discussion, assuming the owner's request implies they have sufficient knowledge and are comfortable with the chosen modalities. Option D. Conduct a comprehensive physical examination and pain assessment. Discuss the scientific evidence supporting acupuncture and therapeutic laser therapy for canine osteoarthritis. Explain the potential benefits, limitations, and expected outcomes of each modality, and collaboratively develop a treatment plan that may include these interventions alongside other appropriate pain management strategies, ensuring the owner understands the rationale and their role in the treatment process. The correct answer is D. Conduct a comprehensive physical examination and pain assessment. Discuss the scientific evidence supporting acupuncture and therapeutic laser therapy for canine osteoarthritis. Explain the potential benefits, limitations, and expected outcomes of each modality, and collaboratively develop a treatment plan that may include these interventions alongside other appropriate pain management strategies, ensuring the owner understands the rationale and their role in the treatment process. Explanation. This scenario presents a common challenge in veterinary practice, where clients may have varying levels of understanding and acceptance of non-pharmacological pain management modalities. A professional challenge lies in effectively communicating the benefits and limitations of these interventions, ensuring client comprehension, and ultimately making treatment recommendations that are both evidence-based and align with the animal's welfare, while adhering to professional standards and ethical obligations. The Certified Veterinary Pain Practitioner (CVPP) designation implies a commitment to advanced knowledge and ethical practice in pain management, necessitating a nuanced approach to client education and treatment planning. The correct approach emphasizes a thorough assessment of the patient's specific needs and the owner's capacity to implement recommended therapies. It prioritizes client education, ensuring they understand the rationale, expected outcomes, and potential limitations of each non-pharmacological intervention. This aligns with best professional practice by promoting informed consent and shared decision-making, ultimately leading to better patient outcomes and client satisfaction. Ethically, it upholds the principle of beneficence by acting in the best interest of the animal and non-maleficence by avoiding unnecessary or ineffective treatments. Regulatory frameworks for veterinary practice, while not explicitly detailed here, generally support evidence-based medicine and client communication. An incorrect approach that solely focuses on the perceived trendiness of a modality without a robust clinical justification fails to meet professional standards. This could lead to the recommendation of ineffective treatments, wasting client resources and potentially delaying or compromising appropriate pain management. Ethically, this is a failure of competence and diligence. Another incorrect approach that dismisses client concerns or preferences without adequate consideration, even if based on the practitioner's expertise, can erode the client-practitioner relationship and may not result in optimal compliance or patient care. This can be seen as a failure in communication and respect for the client's role in the animal's care. A third incorrect approach that overpromises outcomes for non-pharmacological interventions without acknowledging potential limitations or the need for adjunctive therapies can lead to client disappointment and a lack of trust, potentially impacting future treatment adherence. This represents a failure in realistic expectation setting and transparent communication. The professional reasoning process should involve a systematic evaluation of the patient's pain condition, a review of current evidence supporting various non-pharmacological interventions for that specific condition, a thorough discussion with the owner about their understanding, resources, and goals, and a collaborative development of a treatment plan that integrates appropriate modalities, including pharmacologic options if necessary. This iterative process ensures that decisions are patient-centered, evidence-informed, and ethically sound. Question 11. Assessment of the most appropriate analgesic choice for a 12-year-old feline patient presenting with moderate osteoarthritis pain, a history of chronic kidney disease IRIS stage 3, and a recent episode of mild gastritis. The veterinarian is considering several classes of analgesics. Option A. A selective COX-2 inhibitor NSAID, administered at a reduced dose with concurrent gastroprotective medication. Option B. Gabapentinoid, initiated at a low dose and titrated upwards based on efficacy and tolerance, with careful monitoring for sedation. Option C. A non-selective NSAID, administered at a standard dose, with the assumption that its analgesic properties outweigh potential renal risks. Option D. A tramadol-based multimodal approach, focusing on its weak mu-opioid receptor agonist activity and serotonin/norepinephrine reuptake inhibition. The correct answer is A. A selective COX-2 inhibitor NSAID, administered at a reduced dose with concurrent gastroprotective medication. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary pain management, where a practitioner must select an appropriate analgesic for a patient with a complex medical history, including renal insufficiency and concurrent gastrointestinal issues. The challenge lies in balancing the need for effective pain relief with the potential for adverse drug reactions and exacerbation of pre-existing conditions. The practitioner must demonstrate a thorough understanding of drug pharmacokinetics, pharmacodynamics, and contraindications, particularly in vulnerable patient populations. This requires a deep dive into the pharmacology of available agents, considering their metabolism, excretion, and potential side effects, all within the context of the specific patient's physiological status. Correct approach analysis. The correct approach involves selecting an analgesic that is primarily metabolized and excreted via pathways less affected by renal impairment and has a favorable gastrointestinal safety profile. This demonstrates best professional practice by prioritizing patient safety and minimizing the risk of iatrogenic complications. Adherence to evidence-based guidelines for pain management in animals with compromised organ function is paramount. This approach reflects a commitment to the principles of responsible drug selection, ensuring that the chosen therapy is both efficacious and safe, thereby upholding the veterinarian's ethical obligation to provide competent and compassionate care. Incorrect approaches analysis. An approach that involves administering a non-steroidal anti-inflammatory drug, NSAID, without considering the patient's renal insufficiency is a significant regulatory and ethical failure. NSAID are nephrotoxic, and their use in patients with compromised renal function can lead to acute kidney injury, exacerbation of chronic kidney disease, and potentially fatal outcomes. This violates the veterinarian's duty of care and the principles of prudent drug use. Choosing an opioid analgesic that is primarily renally excreted without dose adjustment or careful monitoring also represents a regulatory and ethical failure. While opioids are effective analgesics, their accumulation due to impaired renal clearance can lead to profound sedation, respiratory depression, and other serious adverse effects, jeopardizing patient safety. Administering a medication with known gastrointestinal side effects, such as certain opioids or NSAID, without adequate gastroprotective measures in a patient with pre-existing GI issues is also professionally unacceptable. This demonstrates a lack of comprehensive patient assessment and a failure to anticipate and mitigate potential drug-related harm. Professional reasoning. When faced with a patient presenting with pain and concurrent comorbidities, the professional decision-making process should begin with a thorough patient assessment, including a detailed history, physical examination, and relevant diagnostic tests. This should be followed by a comprehensive review of the patient's current medications and underlying conditions. The practitioner must then consult reliable veterinary pharmacology resources and clinical guidelines to identify analgesic options that are appropriate for the patient's specific physiological status, considering factors such as organ function, age, and concurrent diseases. The risks and benefits of each potential treatment should be carefully weighed, and the chosen therapy should be initiated at the lowest effective dose, with close monitoring for efficacy and adverse effects. Communication with the owner regarding the treatment plan, potential side effects, and expected outcomes is also a critical component of professional practice. Question 12. Comparative studies suggest that while both gabapentin and amitriptyline are commonly used as adjuvant analgesics, their primary mechanisms of action and optimal applications differ significantly. Considering a feline patient diagnosed with chronic neuropathic pain, which of the following approaches best reflects current evidence-based veterinary pain management principles for selecting an adjuvant analgesic? Option A. Administering gabapentin due to its established efficacy in modulating neuronal hyperexcitability and its favorable safety profile in cats for neuropathic pain. Option B. Prescribing amitriptyline based on its broad anti-inflammatory properties, assuming it will address the underlying cause of the neuropathic pain. Option C. Selecting amitriptyline solely because it is a readily available and inexpensive medication, without specific consideration for its mechanism of action in neuropathic pain. Option D. Initiating a combination of gabapentin and amitriptyline at high doses to ensure comprehensive pain coverage for the complex neuropathic condition. The correct answer is A. Administering gabapentin due to its established efficacy in modulating neuronal hyperexcitability and its favorable safety profile in cats for neuropathic pain. Explanation. Scenario analysis. This scenario presents a common clinical challenge in veterinary pain management, selecting the most appropriate adjuvant analgesic for a specific patient's pain profile. The challenge lies in the nuanced differences in efficacy, side effect profiles, and potential drug interactions between commonly used adjuvants like gabapentin and amitriptyline. A veterinarian must synthesize patient-specific factors, e.g., pain type, comorbidities, concurrent medications, with evidence-based guidelines to optimize pain relief while minimizing adverse events. This requires a deep understanding of pharmacodynamics and pharmacokinetics, as well as a commitment to ongoing professional development to stay abreast of evolving research. Correct approach analysis. The correct approach involves a thorough patient assessment to identify the specific type of pain, e.g., neuropathic, inflammatory, mixed, and any contributing factors. Based on this assessment, the veterinarian then consults current, peer-reviewed literature and established veterinary pain management guidelines to determine which adjuvant analgesic has the strongest evidence supporting its use for that particular pain condition in the target species. This evidence-based approach ensures that treatment decisions are grounded in scientific data, maximizing the likelihood of therapeutic success and patient welfare. Adherence to these principles aligns with the ethical obligation to provide competent and compassionate care, as mandated by veterinary practice acts and professional standards that emphasize evidence-based medicine. Incorrect approaches analysis. One incorrect approach involves selecting an adjuvant analgesic based solely on personal anecdotal experience or familiarity with a particular drug, without considering the specific patient's pain type or consulting current evidence. This can lead to suboptimal pain management and potential adverse effects, failing to meet the standard of care. Ethically, this approach risks violating the duty to provide competent care and could be considered a deviation from best practices. Another incorrect approach is to administer multiple adjuvant analgesics simultaneously without a clear rationale or evidence supporting their combined use for the specific pain condition. This increases the risk of synergistic toxicity, drug interactions, and complicates the assessment of individual drug efficacy and side effects. This practice lacks scientific justification and can compromise patient safety, which is a core ethical and regulatory concern. A further incorrect approach is to disregard potential contraindications or drug interactions with the patient's existing medications when selecting an adjuvant. This oversight can lead to serious adverse events, such as organ damage or exacerbation of existing conditions. Veterinary practice regulations universally require practitioners to consider the whole patient and all concurrent therapies to ensure safe and effective treatment. Professional reasoning. Professionals should approach adjuvant analgesic selection by first conducting a comprehensive pain assessment. This includes evaluating the pain's origin, intensity, duration, and impact on the patient's quality of life. Next, they should consult up-to-date veterinary pain management resources, including peer-reviewed journals and consensus guidelines, to identify adjuvant analgesics with demonstrated efficacy for the identified pain type and species. The veterinarian must then consider the patient's individual characteristics, such as age, breed, comorbidities, and concurrent medications, to select the most appropriate agent with the most favorable risk-benefit profile. Finally, a clear monitoring plan should be established to assess efficacy and detect adverse effects, allowing for timely adjustments to the treatment plan. This systematic, evidence-based, and patient-centered approach ensures optimal pain management and upholds professional standards. Question 13. Market research demonstrates a new wearable device that claims to provide objective, real-time measurements of physiological indicators such as heart rate variability and subtle muscle tension, purportedly correlating with a patient's pain levels. As a certified veterinary pain practitioner, CVPP, you are considering adopting this technology to enhance your pain assessment protocols. However, the device's manufacturer provides limited peer-reviewed data and relies heavily on testimonials and internal studies. You are aware that your professional practice is governed by the regulatory framework and guidelines established for veterinary professionals in your jurisdiction, which emphasize evidence-based practice and patient safety. Which of the following approaches best aligns with your professional obligations as a CVPP in this situation? Option A. Thoroughly investigate the scientific literature for independent, peer-reviewed studies, validating the device's accuracy and reliability in measuring pain-related physiological changes in veterinary species. Consult with professional veterinary pain management organizations for their stance on such technologies and await further validation before widespread adoption. Option B. Immediately integrate the device into your practice, as the potential for objective pain measurement is significant, and the manufacturer's claims suggest a promising advancement in pain management. Option C. Implement the device on a trial basis with a select group of patients, using your own subjective clinical judgment to interpret the device's readings, without seeking external validation or consulting professional guidelines. Option D. Adopt the device, but rely primarily on the manufacturer's provided data and marketing materials to train your staff, assuming the technology is inherently beneficial due to its novelty. The correct answer is A. Thoroughly investigate the scientific literature for independent, peer-reviewed studies, validating the device's accuracy and reliability in measuring pain-related physiological changes in veterinary species. Consult with professional veterinary pain management organizations for their stance on such technologies and await further validation before widespread adoption. Explanation. This scenario presents a professional challenge because it pits the desire to adopt a potentially beneficial new technology against the ethical imperative to ensure its validated efficacy and appropriate application within the established regulatory framework for veterinary pain management. The Certified Veterinary Pain Practitioner, CVPP, designation implies a commitment to evidence-based practice and adherence to professional standards, which are implicitly governed by the regulatory bodies that accredit and oversee veterinary medicine. The core of the dilemma lies in balancing innovation with responsibility. The correct approach represents best professional practice because it prioritizes patient welfare and professional integrity by adhering to the established regulatory framework for the use of objective measures in pain assessment. This involves seeking out and utilizing validated tools and protocols that have undergone rigorous scientific scrutiny and are recognized by relevant veterinary regulatory bodies. The CVPP designation signifies a commitment to evidence-based medicine, and this approach ensures that any new objective measure is integrated responsibly, with a clear understanding of its limitations and appropriate application, thereby upholding the standards of care expected of a certified practitioner. An incorrect approach that relies solely on anecdotal evidence or marketing claims without independent validation fails to meet the standards of evidence-based practice. This could lead to misinterpretation of pain levels, inappropriate treatment decisions, and potentially harm to the patient. Ethically, it breaches the duty of care owed to the animal. From a regulatory perspective, practicing with unvalidated tools could be seen as a deviation from accepted veterinary standards, potentially leading to disciplinary action if patient outcomes are compromised. Another incorrect approach that involves implementing the technology without proper training or understanding of its specific application and interpretation of results is also professionally unacceptable. This demonstrates a lack of due diligence and a failure to ensure competence, which are fundamental ethical and professional obligations. Regulatory bodies expect practitioners to be proficient in the tools they employ. The professional decision-making process for similar situations should involve a systematic evaluation of any new diagnostic or assessment tool. This includes 1. Identifying the need or potential benefit. 2. Researching the scientific literature for validated evidence of efficacy and reliability. 3. Consulting guidelines or recommendations from recognized veterinary professional organizations or regulatory bodies. 4. Assessing the practical applicability and cost-effectiveness within the practice setting. 5. Ensuring adequate training and competency for all staff involved. 6. Implementing the tool with a clear protocol for data collection and interpretation, and continuously evaluating its impact on patient care. This structured approach ensures that decisions are informed, ethical, and compliant with professional standards. Question 14. To address the challenge of accurately diagnosing and managing pain in a canine patient presenting with subtle signs of discomfort, which approach best facilitates a comprehensive risk assessment of the underlying pain type? Option A. Focusing only on overt signs of pain such as vocalization or limping, and disregarding less obvious indicators like changes in appetite or activity levels. Option B. Conducting a thorough physical examination, reviewing the patient's history for factors influencing pain perception, and observing the patient's behavior in different environmental contexts to identify patterns of discomfort. Option C. Immediately administering a potent opioid analgesic to address any potential pain, without further diagnostic investigation into the pain's origin or characteristics. Option D. Relying solely on the owner's report of the dog's behavior at home, assuming their description accurately reflects the specific type of pain experienced. The correct answer is B. Conducting a thorough physical examination, reviewing the patient's history for factors influencing pain perception, and observing the patient's behavior in different environmental contexts to identify patterns of discomfort. Explanation. Scenario analysis. This scenario is professionally challenging because accurately differentiating between types of pain in veterinary patients is fundamental to effective pain management. Yet it can be subjective and influenced by subtle clinical signs. A misdiagnosis can lead to inappropriate treatment, prolonging suffering, and potentially causing adverse effects from ineffective therapies. The veterinarian must integrate observational skills, patient history, and an understanding of pain physiology to make an informed risk assessment. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the patient's history, physical examination findings, and response to diagnostic stimuli. This aligns with best professional practice by employing a systematic and evidence-based methodology. Specifically, it prioritizes gathering objective and subjective data to form a differential diagnosis of pain types. This approach is ethically sound as it aims to provide the most appropriate and effective care, minimizing patient suffering and maximizing the chances of successful pain relief, which is a core tenet of veterinary practice. Incorrect approach is analysis. One incorrect approach is to solely rely on the owner's subjective description of pain without further clinical investigation. This fails to acknowledge the limitations of owner perception and the need for veterinary expertise in interpreting clinical signs. Ethically, this could be considered a failure to provide adequate veterinary care, as it bypasses essential diagnostic steps. Another incorrect approach is to immediately prescribe a broad-spectrum analgesic without attempting to characterize the pain. This is a reactive rather than a proactive approach and carries the risk of treating the wrong type of pain, leading to treatment failure and potential side effects. It also bypasses the critical step of risk assessment regarding the underlying cause and nature of the pain. A third incorrect approach is to focus exclusively on observable behaviors without considering the potential for underlying neuropathic or inflammatory processes that may not present with obvious outward signs. This limits the diagnostic scope and could lead to overlooking significant pain contributors. Professional reasoning. Professionals should approach pain assessment by first gathering all available information, including owner reports and signalment. This is followed by a thorough physical examination, looking for specific signs indicative of different pain types, e.g., guarding, lameness, hypersensitivity. Diagnostic imaging or other tests may be warranted. Based on this comprehensive data, a differential diagnosis of pain types should be formulated, allowing for a targeted risk assessment and the selection of the most appropriate therapeutic interventions. This systematic process ensures that treatment is evidence-based and tailored to the individual patient's needs. Question 15. Quality control measures reveal that a canine patient with chronic osteoarthritis, currently managed with a multimodal approach including an NSAID, gabapentin, and tramadol, is exhibiting persistent signs of discomfort and reduced mobility. The veterinary team suspects that the current regimen is not fully addressing the underlying pain modulation mechanisms. Considering the known actions of these drug classes on peripheral and central pain pathways, which of the following adjustments would represent the most logical and evidence-based next step in optimizing the patient's pain management? Option A. Increase the dosage of all current medications concurrently to achieve a stronger overall analgesic effect. Option B. Recommend immediate euthanasia due to the apparent failure of the current multimodal therapy. Option C. Introduce a novel analgesic with a completely different mechanism of action, such as a corticosteroid, without first reassessing the current regimen's effectiveness. Option D. Systematically evaluate the patient's response to each medication individually by temporarily discontinuing one agent at a time, while monitoring pain scores and functional improvement, to identify which component may be least effective or contributing to side effects. The correct answer is D. Systematically evaluate the patient's response to each medication individually by temporarily discontinuing one agent at a time, while monitoring pain scores and functional improvement, to identify which component may be least effective or contributing to side effects. Explanation. Scenario analysis. This scenario presents a professional challenge in managing a chronic pain case where a multimodal approach is indicated, but the patient's response is suboptimal. The challenge lies in accurately assessing the effectiveness of current interventions, understanding the underlying pain modulation mechanisms, and making evidence-based adjustments to the treatment plan without causing iatrogenic harm or exceeding the scope of practice as defined by the Certified Veterinary Pain Practitioner, CVPP, regulatory framework. The CVPP designation implies a commitment to adhering to established veterinary pain management guidelines and ethical standards, requiring a deep understanding of neurobiology and pharmacology. Correct approach analysis. The correct approach involves a systematic reevaluation of the patient's pain status, considering the known pain modulation mechanisms. This includes assessing the contribution of peripheral sensitization, central sensitization, and descending facilitatory/inhibitory pathways. By considering how different drug classes interact with these pathways, e.g., NSAID targeting peripheral inflammation, gabapentinoids affecting central sensitization, opioids acting on descending pathways, a practitioner can logically deduce which mechanism might be inadequately addressed. This approach aligns with best professional practice by prioritizing patient welfare, utilizing a scientific understanding of pain, and making informed therapeutic decisions based on the patient's specific presentation and the known pharmacology of available treatments. It reflects the CVPP commitment to evidence-based medicine and continuous quality improvement in pain management. Incorrect approaches analysis. One incorrect approach would be to simply increase the dosage of existing medications without a clear rationale tied to specific pain modulation mechanisms. This could lead to increased side effects, toxicity, and failure to address the root cause of the suboptimal response, potentially violating the principle of do no harm and failing to meet the standard of care expected of a CVPP. Another incorrect approach would be to introduce a new medication solely based on anecdotal evidence or personal preference, without considering its mechanism of action in relation to the patient's presumed pain pathways. This deviates from evidence-based practice and could result in an ineffective or even detrimental treatment plan, potentially contravening ethical guidelines that mandate informed consent and scientifically sound interventions. A third incorrect approach would be to discontinue all pain management and recommend euthanasia without a thorough reassessment and exploration of alternative or adjunctive therapies. This represents a failure to exhaust all reasonable therapeutic options and may not be ethically justifiable if the patient's pain is manageable with further adjustments to the multimodal plan. It fails to uphold the commitment to alleviating suffering. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive reassessment of the patient's pain, including a detailed physical examination, behavioral observation, and owner-reported changes. This should be followed by a critical review of the current treatment plan, considering the known pharmacodynamics and pharmacokinetics of each agent and their interaction with pain modulation mechanisms. The decision-making process should involve hypothesizing which pain pathways are most likely contributing to the persistent pain and selecting interventions that specifically target those pathways. Consultation with colleagues or literature review for evidence-based strategies is also a crucial step. The ultimate goal is to optimize pain relief while minimizing adverse effects, adhering to the highest ethical and professional standards. Question 16. The risk matrix shows a moderate likelihood of developing chronic pain and associated behavioral issues in a postoperative canine patient if initial analgesic protocols are not meticulously monitored and adjusted. Which of the following actions best demonstrates a proactive approach to mitigating these potential complications? Option A. Implementing a comprehensive multimodal analgesic plan that includes regular reassessment of pain levels and functional status, with clear protocols for escalating therapy based on objective and subjective indicators. Option B. Relying on the initial postoperative analgesic prescription to manage pain effectively for the entire recovery period, assuming the animal will improve without further intervention. Option C. Minimizing owner communication regarding pain management to avoid causing them undue stress and only addressing concerns if they become persistent. Option D. Focusing solely on the surgical site for pain assessment and treatment, disregarding other potential sources of discomfort or the animal's overall well-being. The correct answer is A. Implementing a comprehensive multimodal analgesic plan that includes regular reassessment of pain levels and functional status, with clear protocols for escalating therapy based on objective and subjective indicators. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it requires the Certified Veterinary Pain Practitioner, CVPP, to balance immediate patient needs with the long-term implications of inadequate pain management. The challenge lies in recognizing that seemingly minor or transient pain can escalate into chronic issues, impacting not only the animal's welfare, but also potentially leading to behavioral changes, reduced quality of life, and increased financial burden on the owner due to prolonged or complex treatment. The CVPP must exercise careful judgment to identify subtle signs of ongoing pain and proactively address them, even when the initial presentation might suggest a simpler resolution. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the patient's welfare and adheres to the ethical and professional standards expected of a CVPP. By recognizing the potential for inadequate pain control to lead to chronic pain and its associated complications, the practitioner is acting in accordance with the core principles of veterinary medicine, which emphasize preventing suffering and promoting well-being. This proactive stance aligns with the CVPP specialized knowledge and commitment to advanced pain management. Specifically, it reflects a commitment to ongoing assessment and intervention, which is crucial for managing complex pain states and preventing their long-term detrimental effects. Correct approach is analysis, an approach that focuses solely on the immediate resolution of the presenting pain without considering the potential for chronicity or the development of secondary complications, is professionally unacceptable. This fails to meet the standard of care for pain management, as it neglects the possibility of undertreatment leading to persistent pain pathways. Ethically, this could be viewed as a failure to adequately advocate for the animal's long-term welfare. An approach that dismisses owner concerns about ongoing pain, attributing them to owner anxiety rather than objective assessment, is also professionally unsound. This demonstrates a lack of empathy and a failure to engage in collaborative decision-making, which is essential for effective pain management. It can lead to a breakdown in the client-practitioner relationship and potentially result in the animal continuing to suffer without appropriate intervention. An approach that relies solely on a single diagnostic test or a limited therapeutic trial without considering the broader impact of pain on the animal's overall health and behavior is insufficient. This narrow focus can overlook crucial indicators of inadequate pain control and its cascading effects. It fails to embrace a holistic approach to pain management, which is a hallmark of advanced practice. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's pain, considering not only the acute presentation, but also potential contributing factors and the risk of chronicity. This involves active listening to the owner's concerns, performing a comprehensive physical and behavioral examination, and utilizing appropriate diagnostic tools. The framework should then involve developing a multimodal pain management plan that is tailored to the individual patient and regularly reassessed. Crucially, it requires anticipating potential complications of inadequate pain control, such as the development of chronic pain, behavioral changes, and reduced quality of life, and proactively implementing strategies to mitigate these risks. Continuous learning and staying abreast of the latest advancements in pain management are also integral to this framework. Question 17. Market research demonstrates a growing interest among veterinary practitioners in combining pharmacological therapies for enhanced pain management in companion animals. Considering the Certified Veterinary Pain Practitioner, CVPP, examinations focus on evidence-based practice and patient safety. Which of the following approaches to combining analgesic medications is most aligned with regulatory expectations and best professional practice? Option A. Selecting a combination of analgesics based on their availability and perceived synergistic effects, without a detailed review of peer-reviewed literature on their specific interactions and contraindications in the target species. Option B. Relying on the recommendations of pharmaceutical sales representatives for novel drug combinations, prioritizing their perceived efficacy over independent scientific validation and established veterinary guidelines. Option C. Implementing a multimodal analgesic plan that involves combining agents targeting different pain pathways, supported by scientific literature, with a thorough assessment of potential drug interactions, patient-specific factors, and a clear monitoring strategy for efficacy and adverse events. Option D. Prescribing multiple analgesics from the same drug class to achieve a higher level of pain relief, assuming that additive effects will be beneficial, without considering the increased risk of dose-dependent toxicity. The correct answer is A. Selecting a combination of analgesics based on their availability and perceived synergistic effects, without a detailed review of peer-reviewed literature on their specific interactions and contraindications in the target species. Explanation. This scenario presents a common challenge in veterinary practice: optimizing pain management through multimodal therapy. The professional challenge lies in balancing the potential benefits of synergistic drug combinations with the increased risk of adverse effects, drug interactions, and the need for careful patient monitoring. Regulatory frameworks, such as those governing veterinary practice and drug use, emphasize patient safety and efficacy. Therefore, any approach to combining pharmacological therapies must be grounded in evidence-based medicine and adhere to established guidelines for responsible prescribing. The correct approach represents best professional practice because it prioritizes a thorough understanding of the pharmacodynamics and pharmacokinetics of each agent, their potential interactions, and the specific needs of the individual patient. This involves a systematic evaluation of the evidence supporting the combination, considering the target pain pathways, and anticipating potential adverse events. Adherence to these principles ensures that the chosen therapy is not only effective, but also minimizes risks, aligning with the ethical obligation to provide competent and compassionate care. Regulatory compliance is inherent in this approach, as it reflects a commitment to evidence-based practice and patient well-being, which are core tenets of veterinary professional standards. An incorrect approach that involves combining multiple analgesics without a clear rationale or understanding of their interactions represents a significant regulatory and ethical failure. This could be considered a deviation from the standard of care, potentially leading to adverse drug events, treatment failure, or even iatrogenic harm to the patient. Such an approach may violate regulations concerning responsible drug prescribing and dispensing, as it lacks the necessary justification and risk assessment. Another incorrect approach, such as relying solely on anecdotal evidence or marketing claims without consulting peer-reviewed literature or established clinical guidelines, also constitutes a failure. This demonstrates a lack of due diligence and a disregard for evidence-based practice, which is a cornerstone of professional veterinary medicine and is often implicitly or explicitly mandated by regulatory bodies. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the patient's pain, including its type, intensity, and chronicity. This is followed by a review of available evidence for individual therapies and potential combinations. A critical evaluation of drug interactions, contraindications, and potential adverse effects is essential. The chosen therapeutic plan should be tailored to the individual patient, considering their age, comorbidities, concurrent medications, and owner compliance. Regular monitoring for efficacy and adverse events is paramount, with a willingness to adjust the treatment plan as needed. This systematic and evidence-based approach ensures that therapeutic decisions are both clinically sound and ethically defensible. Question 18. Consider a scenario where a 10-year-old feline presents with intermittent, waxing and waning abdominal discomfort, vocalization during palpation of the caudal abdomen, and a decreased appetite. The referring veterinarian suspects visceral pain but has not identified a definitive cause. As a certified veterinary pain practitioner, CVPP, what is the most appropriate initial course of action to manage this patient's pain and investigate its origin? Option A. Prescribe a non-steroidal anti-inflammatory drug, NSAID, a standard dose for suspected gastrointestinal inflammation, and advise the owner to monitor for improvement. Option B. Initiate empirical treatment with a broad-spectrum opioid analgesic and schedule a follow-up appointment in 2 weeks to assess response. Option C. Recommend immediate exploratory laparotomy to identify and address any potential intra-abdominal pathology causing the pain. Option D. Perform a thorough diagnostic workup, including abdominal imaging, radiographs, and ultrasound, blood work, and urinalysis, while concurrently initiating a multimodal pain management plan tailored to suspected visceral pain mechanisms. The correct answer is B. Initiate empirical treatment with a broad-spectrum opioid analgesic and schedule a follow-up appointment in 2 weeks to assess response. Explanation. This scenario presents a professional challenge due to the inherent difficulty in diagnosing and managing visceral pain in veterinary patients. Visceral pain is often poorly localized, can be referred, and its presentation can be vague, mimicking other conditions. This ambiguity requires a practitioner to integrate a broad range of diagnostic information, consider differential diagnoses carefully, and apply pain management principles judiciously, all while adhering to the ethical and regulatory standards governing veterinary practice. The Certified Veterinary Pain Practitioner, CVPP designation, implies a commitment to advanced knowledge and skill in pain management, necessitating a thorough and evidence-based approach. The correct approach represents best professional practice because it prioritizes a comprehensive diagnostic workup to identify the underlying cause of the visceral pain, rather than solely focusing on symptomatic relief. This aligns with the CVPP ethical obligation to provide competent and responsible care, which includes accurate diagnosis and appropriate treatment. By considering a multimodal approach to pain management, including pharmacological and non-pharmacological interventions, the practitioner is employing best practices for visceral pain, which often responds poorly to single-agent therapy. This approach is also consistent with regulatory guidelines that emphasize the importance of a thorough patient assessment and the development of a tailored treatment plan. An incorrect approach that solely focuses on empirical analgesic administration without a diagnostic investigation fails to meet the standard of care. This could lead to masking a serious underlying condition, delaying definitive treatment, and potentially causing harm to the patient. Ethically, this is a failure to act in the patient's best interest. Regulatory failure would occur if this approach deviates from established veterinary practice standards for pain management and diagnostics, potentially leading to disciplinary action. Another incorrect approach, such as relying exclusively on a single class of analgesics without considering the complexity of visceral pain mechanisms, is also professionally unacceptable. Visceral pain often involves multiple receptor types and pathways, requiring a multimodal strategy for effective control. This approach demonstrates a lack of understanding of advanced pain management principles expected of a CVPP and could result in inadequate pain relief, leading to patient suffering and a breach of ethical duty. A further incorrect approach might involve prematurely recommending euthanasia based on perceived intractable pain, without exhausting all reasonable diagnostic and therapeutic options. This is a significant ethical failure, as it bypasses the practitioner's responsibility to explore all avenues for improving the patient's quality of life. Regulatory bodies expect veterinarians to demonstrate due diligence in pain management before considering euthanasia as a primary solution. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough history-taking and physical examination, paying close attention to subtle signs of discomfort. 2. Development of a comprehensive list of differential diagnoses for the observed signs, considering visceral pain as a primary or contributing factor. 3. Prioritization of diagnostic tests to rule out or confirm specific causes of pain. 4. Formulation of a multimodal pain management plan based on the suspected or confirmed diagnosis, incorporating pharmacological, physical, and behavioral therapies. 5. Regular reassessment of the patient's response to treatment and adjustment of the plan as needed. 6. Open communication with the owner regarding the diagnostic process, treatment options, prognosis, and potential challenges. Question 19. The investigation demonstrates that a canine patient presents with lameness and vocalization following orthopedic surgery. The surgical site exhibits localized swelling and warmth. Considering the distribution and activation characteristics of various pain receptors, which of the following assessments is most critical for a precise risk assessment of the patient's pain experience and the development of an effective analgesic plan? Option A. Administering a broad-spectrum opioid analgesic based on the general diagnosis of post-surgical pain. Option B. Confirming the presence of inflammation through elevated white blood cell counts and C-reactive protein levels. Option C. Evaluating the density and responsiveness of thermal and mechanical nociceptors in the affected limb, alongside the potential for polymodal nociceptor activation by inflammatory mediators. Option D. Assessing the patient's response to a single dose of a non-steroidal anti-inflammatory drug, NSAID, to gauge overall pain severity. Correct answer is C. Evaluating the density and responsiveness of thermal and mechanical nociceptors in the affected limb, alongside the potential for polymodal nociceptor activation by inflammatory mediators. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Veterinary Pain Practitioner, CVPP, to interpret complex physiological data in the context of a specific patient's presentation and to apply that interpretation to a risk assessment for pain management. The distribution and activation thresholds of pain receptors are not uniform across all tissues or all individuals, and their interplay with central sensitization mechanisms can lead to varied responses. A failure to accurately assess these factors can result in suboptimal pain management, leading to patient suffering, delayed recovery, and potential ethical breaches related to animal welfare. The CVPP must synthesize information from various sources, including diagnostic imaging, patient history, and physical examination findings, to make an informed risk assessment. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core of pain assessment by considering the specific types and locations of nociceptors involved in the patient's condition. Understanding the differential distribution of thermal, mechanical, and chemical nociceptors, as well as their relative sensitivities, allows for a more targeted and effective pain management strategy. For example, knowing that certain tissues are rich in polymodal nociceptors that respond to a wide range of stimuli, mechanical, thermal, chemical, informs the selection of analgesics that address multiple pain pathways. Furthermore, considering the potential for sensitization of these receptors, particularly in chronic pain states, is crucial for anticipating and mitigating escalating pain. This approach aligns with the CVPP ethical obligation to provide the highest standard of care for pain management, grounded in a thorough understanding of the underlying pathophysiology. Incorrect approach is analysis. An approach that focuses solely on the presence of inflammation without considering the specific types and distribution of pain receptors is professionally unacceptable. Inflammation is a common cause of pain, but the pain experienced is mediated by the activation of specific nociceptors. Ignoring the nuances of receptor distribution and activation thresholds can lead to a generalized treatment plan that may not adequately address the specific pain mechanisms at play, potentially leaving the patient undertreated. This represents a failure to apply a deep understanding of pain physiology, which is a cornerstone of CVPP practice. An approach that prioritizes a single class of analgesic based on a broad diagnosis, without a detailed assessment of pain receptor involvement, is also professionally flawed. Different nociceptors are responsive to different pharmacological interventions. For instance, neuropathic pain, often involving sensitized C fibers and A delta fibers, may require different analgesics than nociceptive pain arising from somatic tissues rich in mechanical nociceptors. This generalized approach risks overlooking specific pain pathways and thus failing to achieve optimal analgesia, which is an ethical failing in animal welfare. An approach that neglects the potential for central sensitization in favor of peripheral nociceptor assessment is incomplete and can lead to inadequate pain management, particularly in chronic or severe pain cases. While peripheral nociceptors are the initial source of pain signals, prolonged or intense stimulation can lead to changes in the central nervous system that amplify pain perception. A comprehensive risk assessment must consider both peripheral and central mechanisms, including the role of sensitized pain receptors in the periphery and their downstream effects. Failing to do so can result in a treatment plan that only addresses the initial insult, not the ongoing amplification of pain. Professional reasoning. Professionals should approach pain assessment by first identifying the likely source and type of pain based on the patient's history, clinical signs, and diagnostic findings. This involves considering the anatomical location of the pain and the types of tissues involved. Subsequently, the practitioner must consider the specific pain receptors likely to be activated in those tissues and their known distribution and sensitivities. This detailed understanding informs the selection of appropriate diagnostic tools and therapeutic interventions. A risk assessment should then integrate this physiological understanding with the patient's overall health status, potential comorbidities, and the anticipated duration and severity of pain. This systematic approach ensures that pain management is tailored to the individual patient's needs, maximizing efficacy and minimizing adverse effects, thereby upholding the highest ethical standards of animal care. Question 20. Upon reviewing the medical records of a newly admitted canine patient presenting with lameness following orthopedic surgery, a veterinary practitioner is tasked with assessing the patient's pain levels. The practitioner has extensive experience with feline pain assessment, but limited direct experience with canine pain scales. What is the most appropriate approach to ensure accurate and effective pain management for this canine patient? Option A. Rely exclusively on the owner's subjective report of the dog's pain without conducting an independent veterinary assessment. Option B. Utilize a validated species-specific canine pain assessment scale, integrating behavioral observations, physiological parameters, and response to palpation. Option C. Focus solely on the patient's heart rate and respiratory rate, as these are universal indicators of physiological distress. Option D. Apply the feline pain assessment scale the practitioner is most familiar with, assuming general principles of pain expression are transferable. The correct answer is B. Utilize a validated species-specific canine pain assessment scale, integrating behavioral observations, physiological parameters, and response to palpation. Explanation. Scenario analysis. This scenario presents a common implementation challenge in veterinary pain management, adapting pain assessment tools and interpretations across vastly different species. The core difficulty lies in the lack of universally standardized, objective pain scales for all species, necessitating reliance on species-specific behavioral, physiological, and contextual indicators. This requires a practitioner to move beyond a single, generalized approach and engage in nuanced, evidence-based interpretation for each animal, which can be time-consuming and requires a high degree of clinical expertise and ongoing learning. Correct approach analysis. The correct approach, which involves utilizing validated species-specific pain assessment tools and integrating multiple data points, behavioral, physiological, and contextual, represents best professional practice. This aligns with the ethical imperative to provide the highest standard of care, which includes accurate pain assessment for effective management. Regulatory frameworks for veterinary practice, while not always explicitly detailing pain scales, mandate competent and ethical care, which inherently requires the use of the most appropriate diagnostic and assessment methods available for the species in question. Relying on species-specific tools ensures that subtle signs of pain, unique to that animal's physiology and ethology, are not missed, leading to more accurate diagnosis and treatment. Incorrect approach is analysis, an approach that relies solely on a single, generalized pain scale designed for a different species, e.g., using a feline scale for a canine patient, is professionally unacceptable. This fails to acknowledge the significant species-specific differences in pain expression and perception, leading to potential under- or overassessment of pain. Ethically, this constitutes a failure to provide competent care. From a regulatory standpoint, it could be viewed as a deviation from accepted veterinary standards of practice, potentially violating general provisions regarding the provision of adequate and appropriate veterinary services. Another incorrect approach would be to disregard behavioral changes entirely and focus only on physiological parameters like heart rate and respiratory rate. While physiological changes can be indicators of pain, they are not specific to pain and can be influenced by numerous other factors such as excitement, fear, or environmental temperature. Relying solely on these can lead to misinterpretation and inadequate pain management. This approach fails to meet the standard of comprehensive pain assessment and could be considered negligent care. Finally, an approach that relies solely on owner reports without objective assessment is also professionally deficient. While owner observations are valuable, they can be subjective and influenced by the owner's emotional state or prior experiences. A veterinary professional has a duty to conduct their own objective assessments using validated methods. Failing to do so bypasses the core responsibilities of a veterinarian in diagnosing and managing pain, potentially leading to suboptimal outcomes and failing to meet professional standards. Professional reasoning. Professionals should approach pain assessment by first identifying the species of the patient. They must then consult available validated pain assessment tools and literature specific to that species. This involves observing a range of indicators, including behavioral changes, e.g., posture, vocalization, activity level, physiological parameters, e.g., heart rate, respiratory rate, blood pressure, temperature, and contextual factors, e.g., response to palpation, interaction with the environment. Integrating these data points allows for a more accurate and nuanced assessment of pain severity and location, guiding appropriate therapeutic interventions. Continuous reassessment and adaptation of the pain management plan based on ongoing observations are crucial components of this process.